Hi, I'm Dr. Kathy Webb from Action Medical Center talking about knee pain, arthritis, and no, you don't have to live with it. Knees are one of the most common problems that people have. In fact, humans are one of the few creatures that spend all its time on its hind legs. Very few other animals do so. In fact, there's only one other true biped, but his posture is not so good, so we're not going to include him in our discussion on knees today. But because of the tall nature of humans and the weight-bearing capacity of knees, the knee is one of the most commonly injured structures in the human body. In a healthy knee, the top bone comes down. You can actually see the two ends of the bone that fit into the two plates below it. And it should glide as we move balanced and level all the time. So on an x-ray, it should look just like this, where we should see this nice big space in between the knees. The problem is many people do not have normal, healthy, aligned spines. If the spine shifts out of position, it changes the way we weight bear on the knee, and it throws the weight mostly to the middle part of the knee. When the spine's out of position, throws that weight to the inside part of the knee. When that happens, instead of the knee gliding, it tends to grind, and that friction starts to grind away at the cartilage in the knee. And what we see on x-ray looks like this. Instead of our nice, healthy space, we start to see that damaged joint cartilage in the knee. On here, you can actually see a true picture of a knee where you can see the grinding taking place in the cartilage before the knee actually ends up as bone on bone. So in a normal knee, as the top bone comes down, there's a little Teflon cartilage layer on both ends of the bone, and in between there's a membrane that has a lubricating fluid that's very much the consistency of an egg white that allows the knee to glide on a nice cushion rather than grind. So the lubricating fluid, or hyaluronic acid, is generated with normal motion. It's a lubricant as well as a shock absorber, and it nourishes the cartilage. So when we don't have that hyaluronic acid when the knee's been grinding, we do not have normal knee function. So you have options for what to do with your knee. You can do nothing, wait till it gets worse and then deal with it. You can try to exercise on your own. You can do some of the injections. You can do steroid injections, which calm it down for a while, or you can just try to do the injections on your own where they do a little bit of hyaluronic acid. You can wait until you need knee surgery to clear out the grinding cartilage in the knee, or wait till you need a full knee replacement, or you have another alternative. Or you can take advantage of the program that we've designed at Action Medical Center. It is not a new program. This program is in use in very impressive clinics around the country, but it is new to Augusta, where we're able to offer multiple treatment options to help slow down and recover from knee arthritis and pain. First, we need to make sure we have the correct diagnosis. So one, what we need to do is we need to make sure exactly what type of knee problem that you have. Depending on the type of program, the treatment options are completely different. First, we need to make sure that we have damage to the knee. If we have damage to the knee, you may need all the elements of the program. If you only have partial damage, you may only need one or two elements of the whole program. So first we need to make sure we have the correct diagnosis. We have to replace the hyaluronic acid or lubricating fluid inside the knee. Then we want to make sure we develop a functional strengthening program that holds the muscles together that keep the knee gliding instead of grinding. Also, we need to support the knee, and we need to check the joints above and below, the spine and the foot, to make sure problems above or below the knee aren't part of what's causing the problem and keep the knee pain coming back. So how do you get the hyaluronic acid back in the knee? Where the top bone and the bottom bone meet, there's a little layer of Teflon coating at the ends of the bones to allow them to glide. And in between that Teflon coating, there's a layer of lubricating fluid that's very much the consistency of an egg white. There's a product called Gel-Syn 3 that's FDA approved that helps replace the hyaluronic acid in the knee so the knee goes back to gliding instead of grinding. It's very safe, all natural, very few side effects, and is designed to put the lubrication back in the knee. And we also use ultrasound guidance because many times, even if we put hyaluronic acid back in the knee, if it's not placed correctly, that fluid does not get into the knee where it belongs. So in summer, we make sure we have the correct diagnosis for your knee. We replace that hyaluronic acid that lubricates the knee, and often we need a series. People have had sometimes one injection, one doesn't work. The series is what makes the difference. Also, we need to make sure that we use that ultrasound guidance to put the knee lubrication in the right place. And it cushions the knee so that as you move, it glides and it slows down the rate of wear and tear in the knee. Also, it's extremely important that we get support for the knee in the form of a brace. The knee, again, if it shifts out of position when you move, it grinds. And without support, that knee will not heal and recover. The VQ OrthoCare knee brace is very lightweight, wraps only around one side of the knee, anchors beautifully with straps to allow the knee to function better, heal better, and recover. Most insurance companies cover this program. They like it better than knee surgeries. People recover better, knees last longer. And you have to remember that injections alone have only limited value. It's the combination, that team approach, that puts the hyaluronic acid back in the knee to get the lubrication in place. It braces the knee so the knee glides instead of continues to grind. We stabilize the spine above that's creating part of the knee problem. We look to the foot below and strengthen the muscles that hold that knee in place so that it decreases discomfort, slows down the rate of wear and tear, and gets you much better, much healthier, much stronger knee and a happier lifestyle as you can move and function more comfortably. And don't delay. Take time to call as soon as you can to schedule a complimentary consultation to see if this program can help your knee. Most people wait too long until there's too much damage, and it will never be easier to get your knee better than it is now. We look forward to seeing you.